Good morning. Good morning, everyone. Beautiful Saturday morning in Houston, Texas, and the Texans are going to win, right? And we'll get you out of here so you can go enjoy it. For those of you who aren't from here, we have a very good team that's about to play at 3:30 today on TV. So we're all anxious and wanting them to do well. Welcome to the second day of our Region 6 Asian American Pacific Islander Health Summit. If that's not where you are supposed to be, stay with us anyway, because it's going to be great. But we're really happy to have you. And I'm Regine G. Calvert. Some of you may not know me, but I'm an old timer. I call myself an elder statesman. So that sounds a little bit better, but I've been around for a long time. And I had a hand, as did Dr. Beverly Gore. And is Lynn with us today? She'll be here. A couple of others that had a hand in starting the Asian American Health Coalition back in the mid 90s. And eventually we got Hope Clinic developed in 2002. So we're celebrating our 22nd anniversary for Hope Clinic, and we're very proud of it. So thank you for being here in our new building. We opened it officially in March, but all of our staff and programming started in May. So it's been tried and tested. It's working really well. And so today and yesterday, we put it to the true test. This is the first multi-event, room event that we've had. And so we really commend our staff. Some of them are in the back of the room, our technical staff. We commend all of our staff. And Shane, I saw Shane, is she here? Shane Chen, our COO, has been very instrumental in helping get everything going with us. Dr. Gore is our chairperson of the summit, and myself and our planning committee. Please raise your hand. Just want to thank you. So several of them are here. And without them, we couldn't have done this, but you know how great volunteers are. So again, I want to thank the sponsors as well. I know a couple are here with us. AARP, Tina is back, and Eddie. And I think Memorial Herman. I know Albert was here. Who else? What other sponsors do we have in the room? Just raise your hand and let us appreciate you. Yes, there we go. Is it UT? Memorial Herman. Okay. So as you know, the summit's theme is AAPIs and mental health, acute problems in need of timely solutions. And I hope those of you that were with us yesterday and went through the breakout sessions will have learned a lot. I've heard comments that I didn't know that, data that we were able to unveil. And even a couple of our presenters said, you know, having to do this presentation caused me to look into stuff. And I didn't realize we had all of this good data. So that was part of our goal. Mental health is a very important topic for all of us to address. We have all heard about the stigma associated with seeking mental health services. And although the stigma exists in all communities, as we've said, it runs particularly strong in our AAPI community. And we talked about that. It's the strong cultural value towards saving face. That's just a cultural thing that we all have experienced. Avoiding exposing weaknesses or sharing negative thoughts to the point that many suffer in silence. The goal of this year's summit is to begin the discussion about mental health in our AAPI community and to unwrap some of the stigma that surrounds it, to safely relieve some of those tensions under the surface. So we hope that you come away with some new knowledge, with some new friends, and some new tools to help in reaching that goal. The program planners prepared 4 tracks in concurrent breakout sessions, which we will go into after this morning's plenary session. And they will allow us discussions on the mental health concerns for the youth, that's 1 track, older adults, 2nd track, family and domestic issues, 3rd track, and community in general. But before I introduce our keynote this morning, I have a few announcements, as you know, last minute changes or alterations that we wanted to make you aware of. Room changes in case there was some discrepancy in some of our materials. The family and domestic issues and youth issues are going to combine at 9:45. That's our next breakout. They will be meeting in Community West, which is this side of this room. West is here, East is here. The community issue session will meet in the Community East, which is this session. Older adults will be in what we call the Chang room, which is the second floor. So just go to take the elevator or the stairs to the second floor, and it's in the Chang room. Okay. For the 11:15 session, the second one, the youth session will be on the second floor of the Chang room. The family domestic issue session will be in the third floor. So you have to go up to the third floor boardroom. The community session will be in West, this side, and adults will be in East, this side. Now, I have some really great announcement, and unfortunately, I don't think she's here, but last night, some of you stayed for the poster session, and we had some outstanding submissions. It was so outstanding that we stayed here till almost 8 o'clock because the judging didn't conclude, but they finally came away with a winner. The winner of the poster session, and it's a $100 award, is Dr. Karina Katopik of the UT School of Nursing. So we want to congratulate her. I know she's not with us today. She told us last night she's going to have her chauffeur hat on today to pick up and take her kids to whatever they have to go to. But we will send her award check and thank her for joining us. I want to remind those of you who are wanting to receive continuing ed hours, the Hall Foundation of Mental Health is providing up to 6.5 hours of continuing ed for individuals with license for the following: the Texas State Board of Examiners of Marriage and Family Therapists, Texas State Board of Examiners of Professional Counselors, Texas State Board of Social Work Examiners, and Texas Certification Board of Addiction Professionals. That includes recovery, support, peer specialists, mental health peer specialists, and peer specialist supervisors. However, you must sign in and out of the sessions you attend so we can validate your attendance and complete the evaluation after each session to get your credit. There's a QR code which will be shown at the end of each session to help you complete that evaluation online. After the 2 breakout sessions today, 11:15 is the second one, and that should be over about 12-ish. We encourage you, we don't encourage you, we plead with you to come back to this room because we have a very special speaker, my dear friend, Dr. Anlan Nguyen, and she will close out the session with a call for action, a very inspiring, motivating message to us. Now, I would like to introduce our morning plenary speaker. We were expecting someone else, a dear old friend of ours, Dr. DJ Ida from Colorado. And she had some personal things that came up, and at the last minute was able to give us a wonderful fill-in. And she's not a fill-in, she's a great person in her own right, and we're so glad to meet her and know her now. I'd like to introduce Dr. Peta Suyumoto. Dr. Peta Suyumoto is a feminist scholar, a writer, an educator, a curriculum developer, equity trainer, mental health activist, a jewelry maker, and avid bicyclist. Doesn't she sound intriguing already? She earned her PhD from the University of Pennsylvania and did her research on anti-racist education and issues of race and racism. She was the training director for the National Asian American Pacific Islander Mental Health Association. We call it NAPIMA for short and enduringly, and a master trainer for NAPIMA's Achieving Whole Health program. Peta is the director of the National Asian American Pacific Islander Empowerment Network, which is a network of Asian American, Native Hawaiian Pacific Islanders with lived experience related to mental health concerns. She is the Associate Director of Equity at the Massachusetts Coalition for Suicide Prevention, which is where she's based in Boston, Massachusetts. I'm going to go down a little bit to her bio. She has outspoken and written, she has been spoken and written about being a suicide attempt survivor and her struggles with chronic depression and complex PTSD. She is a co-founder of the Breaking Silences Project, which is an artistic endeavor. So she's got her right and left side of her brain very well developed. And the Breaking Silence Project is just an artistic endeavor that educates about the high rates of depression and suicide among Asian American young women. Yesterday's discussion, we talked about the high rate of older women, but we see that it's also high with young AAPI women. Peta is a member of a number of boards and committees. She has been just recently named the incoming executive director of NAPIMA to succeed our good friend DJ Ida. So we're really anxious to continue working with her. When I asked her about something unique in her life so I could share with you, she says it's the last part of my bio, which is her claim to fame is that she rode her bicycle across country in the summer of 2012. And I know she'll share some of her adventures with us. So please join me in welcoming Peta to our podium today.
Hello, everyone. It was funny, she was talking about the right and left brain. I actually was a high school teacher, and I taught English and biology. So, that really is part of who I am. So, let's see. Let me see if I can do this. There we go. Okay. So I want to talk about AA and HPI mental health. And I'm going to start with a little bit of my lived experience. When I was 16 years old, I tried to take my life. Like most suicide attempt survivors, the reasons for my attempt were complex. I had, of course, the normal stressors of any teenager, school, peers, and college applications. I also had the historical stress of being a daughter of a father who was in prison during World War II solely because he was of Japanese descent. When he left that camp and moved to Ohio, he was told by a math teacher he would not amount to anything. Take note, my father earned a PhD in mathematics. Yet the internment and the racism he faced at the time impacted his identity as a Japanese American and led him to try unsuccessfully to assimilate into the dominant white culture. He married a white woman and moved east to a white neighborhood with good schools. Growing up in a white community meant that we were always seen as other. The only people who looked like us who had similar cultural experiences were our cousins who lived about an hour away. I had no Japanese American or Asian American community growing up. We experienced racial taunts and a sense that we did not belong. In addition, my mother suffered with bipolar disorder, and we were ostracized for that as well. I did well enough in school, but felt the pressure of the model minority myth and familial expectations. I did not feel I was enough. My self-esteem was non-existent, and I had a genetic predisposition to mental illness. My mother and my father's family both had mental illness on both sides. I felt I was a burden to my family and that they and I would be better without me. I struggled with chronic major depression and complex PTSD since I was 12, and I continue to manage my mental health conditions through treatment, self-care, and meeting-making work and activities. I have lived through deep depression where I cried every day for years. I lived through treatments and many medications that didn't work. I lived through long-term healing. I am the poster child for mental health recovery. I am fortunate. I had access to treatment, access to health insurance, access to providers, and knowledge of how the medical system works in this country. I also speak English, which meant that language was not a barrier for me getting services. And I still face a stigma and shame in my family. And in my experience, up until 10 years ago, and I'm in my 60s, no practitioner, none, ever asked how my cultural background affected my mental health. I find that astonishing, personally. I tell you this to highlight some of the issues faced by AA and HPIs with lived experience. I tell you this because we need to remember that behind the policies and strategies to improve the mental health system for AA and HPIs, there are individuals and families and communities that are suffering. The myth of the model minority claims that AA and HPIs don't have mental health issues. It states that in terms of the values and norms of the dominant societies, Asian Americans in particular are doing well and don't need mental health services or culturally appropriate interventions. This, as I think we all know in this room, is false. Mental health is a defining issue in AA and HPI communities, especially now with the rise of anti-Asian hate and the impact of the COVID crisis on our mental health. In addition, we generally don't talk about issues in our families and our communities, and people who have mental health conditions still face stigma and shame. In our hugely diverse AA and HPI communities, we need to redefine mental health. Mental health is not just mental illness. Everyone has mental health, and we need to talk about the issues and promote mental wellness. We need to move from addressing mental health solely at the individual level and instead take a public health approach that addresses not only the social and political determinants of health, but also the systems issues in mental health that create barriers for AA and HPIs to getting culturally appropriate individual and community care and interventions. At the federal level, NAPIMA has been tracking the Biden administration and the Congress and the federal agencies' actions that promote the concerns of AA and HPIs and promote mental health, or both. I know that's hard to read. I'm really sorry. I will read it. I'm going to read it, so don't worry about it. Okay. But if they send out the slides, you'll have it. You know what I mean? So in 2021, on January 21st, Joe Biden issued the Executive Order 1399-5 on ensuring an equitable pandemic response and recovery, which authorized the creation of the Presidential COVID-19 Equity Health Task Force, which included a working group specifically dedicated to addressing challenges faced by AA and NHPI communities. On January 26, President Biden introduced a memorandum condemning and combating racism, xenophobia, and intolerance against Asian Americans and Pacific Islanders in the United States. On May 28, 2021, President Biden issued Executive Order 14031 on advancing equity, justice, and opportunities for Asian Americans, Native Hawaiians, and Pacific Islanders, authorizing the creation of the President's Advisory Commission on AA and HPIs within the Department of Health and Human Services, as well as the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, otherwise known as WNAPI, which someone was commenting about all of our acronyms, right? We have a lot of them. On July 16th, 2021, the Department of Health and Human Services released a request for information in the Federal Register to gather public input on best practices to advance cultural competency, language access, and sensitivity towards AA and NHPIs. December 7th, the Surgeon General issued an advisory on youth mental health crisis further exposed by the COVID-19 pandemic. And December 20th, President Biden appointed 25 leaders as commissioners to the President's Advisory on Asian Americans, Native Hawaiians, and Pacific Islanders. The commission is charged with coordinating the whole of government agenda to advance equity, justice, and opportunity for AA and HPIs communities. So we see a lot of activity, I mean, comparatively speaking too, right, in the Biden administration. I'm gonna go through some 2022 actions. In January 20th, the Biden and Harris administration put a fact sheet that on advances equity and opportunity for AA and HPI communities across the country. May 2023, the Surgeon General issued an advisory on addressing health worker burnout, and the U.S. Surgeon's Advisory on building a thriving health workforce. The advisory underscores the urgent need to support our health workforce and respond to the burnout crisis. June 24th, Congress passed a bipartisan Safer Communities Act, and President Biden signed the bill into law the following day. The bill dramatically increases funding for life-saving mental health and substance use care programs by expanding the certified community behavioral health clinics nationwide and boosting funding for 988 implementation and crisis services, mental awareness training programs, and community mental health block grants. And 988, as people know, just want to make sure people know, is the 3-digit number for crisis services in this country now. July 16th, the National Suicide Prevention Lifeline moved to the 3-digit 988 code. And on December 9th, HHS awards nearly $700,000 to the state of Hawaii to develop the AA-NHPI Health Center of Excellence. And there are more, we have our current priorities on our website as well. So please go to NAPIMA's website, which is napima.org. And if you want to look at policy, particularly, you can go /policy. But in 2022, there was a recommendation on the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders released its inaugural report, which details Commission's first set of recommendations to advance equity, justice, and opportunity for AA and HPI communities. The Health Subcommittee submitted the following recommendation. The Commission recommends the Department of Health and Human Services, in coordination with the White House Office of Public Engagement and the Commission, hosts a mental health summit focusing on AA and HPI's mental health. And the following following that recommendation, in 2023, NAPIMA was involved in 2 federal initiatives about AA and HPI mental health. So the first one was in a WINAPI summit. And so that was on July 20th, 2023. The Biden-Harris administration hosted its inaugural mental health summit, focusing on improving equity and access to behavioral health for AA and HPI communities. This historic event was hosted by the White House, by WINAPI, right, and the U.S. HHS and SAMHSA, the Substance Abuse and Mental Health Services Administration. It was held in recognition of National Minority Mental Health Awareness Month and builds on the administration's unprecedented investments in to connect more Americans with care. The goal of this one-day in-person invitational summit was to identify innovative solutions and actions across communities and government stakeholder groups to address persistent and emerging challenges to the mental health and well-being of AA and HPI communities. So there are 4 different themes. The first one was the impact of hate crimes, violence, racism, and microaggressions on mental health, harnessing collective and cultural strength. This session examined the rise of hate crimes, violence, and targeting of AA and HPIs during COVID-19 and beyond, and the impacts on AA and HPI mental health and strategies for coping. The second session was Beyond Stigma, Expanding Access and Integrating Care. This session discussed integrating physical and behavioral health to manage stigma and impediments to accessing appropriate cultural and community-based care, as well as what it takes to put those strategies and models into practice. Session 3 was Navigating Innovative Models, Embracing Solutions. With the explosion of mental health needs in post-pandemic, how can community-based organizations become part of the delivery models such as 988 crisis networks and the certified community behavioral health centers, and bring critical federal resources to their communities? This session examined strategies for building state and community partnerships. And what was interesting, just as a note, is each of those sessions had people with lived experience. And actually, I spoke on the 988 one to talk about issues in 988, as well as community health centers. Session 4 was Leading with Language, Community and Culture for AA and HPI Mental Health. And this experimental dynamic session helped summit participants understand the fear and anxiety of not being heard and not being understood in crisis, and highlighted community solutions for mental health, focusing on language access for AA and HPI communities as an essential tool for quality care and safety. Now, often these meetings are standalones, right? You have the White House or someone does this big meeting and then what? Nothing, right? Nothing. But this was not the case. I was like shocked and pleased that this was not the case in this time. So in August, we were, this summit was followed by a working meeting that focused on similar themes called Pathways Forward, Action Plans to Advance AA and HPI Mental Health. Now, and this was put on by SAMHSA and the Office of Behavioral Health Equity. And similar themes, and I'm going to talk about each of these themes in a minute, but hold on one second, I need to get a little. So building the behavioral health workforce to better serve AA and HPI communities, language access and assistance, bringing new partners and strategies together with a sense of urgency, taking action on anti-AA and HPI hate, policies, tools, skills, and new playbooks that can prevent negative impact on mental health and well-being of individuals and families, and engaging AA and HPI communities with the 988 Crisis Response Network. So I'm going to take just a minute and talk about each of these areas. So workforce development. And actually, NPIMA was very well represented in these meetings. I think we were, of the four, we had 3 representatives. And DJ is very, DJ Ida, who was supposed to be here, but couldn't be. She is very interested in workforce development. And workforce, we're not just talking about MDs and PhDs, although that's important, but we need to expand the workforce. We know there's a lack of providers that in terms of, AA and HPI focused providers. And some of the, ways of dealing with that are integrated care, right? We talk about, to reduce stigma, being able to be not have to go to a mental health clinic, all that. And we also need to create pipelines for clinical education as well, right? I mean, we need young people to go into that field. And, we really need to make it clear that we can talk about these issues and that we need people who are culturally responsive to talk about these issues as well. We need to expand the community workforce, community health workers, certified peer specialists. In San Francisco, there's an organization, RAMS, that has a whole peer specialist program. It's really, this is a way that we can make a difference in terms of workforce. And in terms of clinical education, even in general, right? I mean, not just for AA and HPIs, but generally speaking, we need more culturally relevant education, cultural humility, cultural relevance. How do you deal in communities that aren't your own, right? In terms of language access, and the doors is like the door being shut on language access. I couldn't find a good picture for that slide. But anyway, we need interpreter training. I mean, if a clinician is working with an interpreter, they need to know that the interpreter is trained in mental health in particular, because it's different. I used to be a sign language interpreter, and I never did mental health because it is so sensitive, right? I mean, you have to be able to really know. And if you're of the culture, you also have to have the boundary of knowing where you are as an interpreter and what your role is. Translation of resources. They're not resources, but if you have translation of resources, you need to have in-language services or services that can, with interpreters that can meet, having resources and then having those persons have no place to go doesn't make any sense. And we need community partnership between culturally based organizations and mental health services. So we need to be able to bring all of that together in order to have a better language access for people. And NPIMA does interpreter training. DJ has a whole program of how to do mental health interpreter training in particular, right? So another theme that was part of this Pathways Forward was anti-Asian hate. Discussion of things like bystander trainings, both for AA and HPIs as well as other people. And anti-racist education focusing on AA and HPI experiences, as well as people probably know that there's been a tracking of these incidents. And just looking at the data is really important because then we can see how that data impacts our mental health. And in fact, the Stop AAPI Hate also tracks, had done some surveys on mental health, on whether people feel safe and all that kind of thing as well. In addition, the last theme was 988. And there's a lot of concerns about 988. I mean, first, people don't know about it. Even in the general public, people don't really know about 988. But in terms of communities of color, historical distrust, concerns with confidentiality and police involvement. In addition, we have language access issues here as well, right? I mean, do the counselors know how to use an interpreter? And in fact, when I ask the different centers, it's center to center. It's not like a national thing that, where people can learn how to use an interpreter. We need to focus on how communities understand 988 and, the issues of stigma and need about education about what 988 is. We need to have cultural humility and implicit bias training for 988 call counselors. And we need to start with the community and the needs of the community. How do we, how does 988 respond to our communities? And it seems to me that we always need to fit into the models of the dominant culture rather than the dominant culture asking, well, what do you need? What do you need, right? Now, NAPIMA's work specifically addresses these issues and more, actually. And I want to talk a little bit about what NAPIMA does. So our mission is to promote and redefine mental health and well-being of AA and HPIs, individuals and communities through trainings, programs, policy, advocacy, and centering those with lived experience. The vision is NAPIMA envisions a mental health wellness for all people, a world where mental health is destigmatized and AA and HPI individuals and communities are able to access the care and information they need for their well-being. So we do a number of things. We have cultural informed trainings, which include Achieving Whole Health, a program called Achieving Whole Health, Body, Mind, Spirit, which is a wellness training where people go through elements of body, mind, spirit, and then create a health goal. And this is a really powerful training. It's not rocket science, mind you. It's just very powerful because people can take control of their own health goals. We do interpreter training, to train interpreters on how to work in mental health settings. We have a training called Growing Our Own, which was started primarily for clinicians and how to work in the communities. But we're actually going to expand it to anyone working in AA and HPI communities. And then we have mental health first aid training, which is from the National Council. It's not a training we developed, but we add our cultural AA and HPI cultural concerns into that training. So we're doing this for primarily AA and HPI communities. We have community-based programs, and it was already mentioned that NAPIAN, which is the National AAPI Empowerment Network, and that's a network of people with lived experience. And the mission of NAPIAN is we work first to support each other in a world that is not always welcoming to Asian Americans or those with mental health challenges and experiences. We share our experience, knowledge, and unique perspectives to inform mental health practice and policy and to tear down stigma and stereotypes within our communities and beyond. And this network, we have network meetings, we have listening circles for different issues. We're having one in February on anti-Blackness in AA and HPI communities and what that means and how we are located in the sort of racial dynamics of this country. We have special interest groups. We have one on parenting and one on the arts, using the arts for healing. So we're really gearing up this year to be more active. We have a youth program called Friends Do Make a Difference, which is getting youth peer-to-peer to talk about mental health issues. And we have a Healing Through the Arts program. Over the initiative Asians in Focus was created by NAPIMA in recognition that mental health takes many forms. And this is a place where artistic expression and stories are valued. Asians Unmasked is a project using photography that captures a historical moment of COVID-19. It's a photo voice project that's on our website. And Heart's Hope was a Healing Through the Arts project for a young fellow who died of suicide. And his family donated some money and we created this program to honor him and his family. And then we have community-driven policy and advocacy. So we work at the individual level all the way up to the policy level. And we have AA and HPI mental health coalition efforts. We're in a lot of committees, mental health policy and tracking. And we have a new initiative. Okay, I'm getting time messages and I can't see them because I'm blind. Okay, so we have a Vote for Wellness. And yeah, I should be able to do that. So Vote for Wellness Initiative, which is civic engagement and why it's important for mental health to vote, right? To actually be engaged civically. Other partnerships and initiatives, we're working on a research project with Taft Foundation, and our role is to strengthen how research is implemented and distributed and who is impacted. So we're very much, you have to start with the community. And in addition to that, we have May 10th, which NPIMA has worked to establish May 10th as National AA-NHPI Mental Health Day. In 2010, RAMS in San Francisco got a proclamation for California and San Francisco to establish May 10th. And then in May 10th, 2021, Representative Judy Chu, in collaboration with NPIMA, introduced the first ever congressional resolution to recognize May 10th as AA-NHPI Mental Health Day. And our mental health is impacted by all aspects of our lives, and yet it's a topic that we don't talk about. So this Mental Health Day raises awareness in our communities, and hopefully we'll be able to leverage resources for our community organizations and develop partnerships and advocate for policies to increase culturally relevant services. This year, the resolution will be introduced again on May 10th, making it the 4th anniversary. And this is particularly important amidst the rise in anti-Asian racism and violence. And it's critical to celebrate the center mental health and well-being of AAH and APIs communities nationwide. And we really encourage you, because we, last year, I guess Dallas participated, because cities can do proclamations, and you can just go onto the city website and actually request a proclamation. So if any of you have that inclination to do this for Houston or for Texas, there's a whole thing on our website about how to do it. And we invite you to join us in this. You know, we're trying to get all 50 states. We haven't managed that yet. And finally, we need to redefine mental health and normalize conversations about mental health among our family, friends, and in our community. We need to continue to work on many fronts to make culturally humble and appropriate care available and accessible. We need to continue to work on systems issues that continue to create barriers for AA and HPIs to create healthy environments for mental wellness. We need to listen to and center voices of people with lived experience with mental health concerns, because our knowledge and experience can enlighten and inform all the work that we do. And finally, we need to be thankful for those who have come before us and laid the groundwork for innovation we're doing now. Okagasama Day means thank you, but it really means in the shadow of. Kaga is the Japanese for shadow. And it's thank you for those who've gone before. Maybe people we don't even know, right? That we don't see. People who have done the work that allow us to do our work now. So, and the things that you do now also make a difference. And so people will owe you a Kagasama Day as well because of the work you're doing. And so it means grateful with gratitude in the shadow of. And so I offer you this and feel a Kagasama Day for the work that you have all done that has come before me. And thank you.